So yeah, a lot of times this doesn't really cause symptoms until a rupture. So when you have a rupture, we typically think of something called a thunderclap headache. So that's kind of similar to what Jennifer described, where you really have a headache that is almost maximal at onset, very severe pain, often associated with stiffness in the neck. People generally are very sensitive to light. It's called photophobia. And then often a lot of nausea and vomiting with the headaches.
Staten Islander News is here today with a positive patient story with Jennifer and Dr. Aids. I wanted to just kind of ask each of you to introduce yourselves. And you can start with whichever one of you would like to start first, but probably Jennifer. So if you want
Okay.
to tell us a little bit about yourself, and
So my name is Jennifer. I just turned 38 2 days ago, I think. Yeah, the 19th. Um, I'm a new mom. My son is now 8 months in a few days. Um, I used to be a medical assistant. I used to work in the healthcare industry, and life has changed a bit, but I was very just I used to go out, do a lot of things, and life is just different now.
okay. And Dr. Aids, if you want to tell us a little bit about yourself.
Yeah, sure. Happy birthday, Jennifer. Even though you turned
Thanks.
38 now. So I'm Laura. I'm one of the vascular neurologists over at NYU Brooklyn in Sunset Park. There are about four of us. Usually people call us the stroke team because we generally are seeing ischemic strokes, hemorrhagic strokes. But we take care of aneurysm patients who have bleeds like Jennifer did, generally after they come down from the neuro ICU. So we work pretty closely at Brooklyn with the neuro ICU team as well as the neurosurgery team. And then, of course, our rehab team, which does a phenomenal job getting people actually back to the point where they can get out of the hospital and get home with some sort of function to kind of get back into their normal life.
Oh, perfect. Jennifer, and happy birthday also.
Thanks.
And if you want to just kind of tell us about your journey and whatever you're comfortable with sharing, feel free to, let us know as much or as little as you would like about kind of what happened to you, that kind of brought you to this point.
Sure. So it was I had no idea. Like that even I didn't think that this would ever be my situation. I've heard about it and I know people who have had aneurysms, but I never thought it would be me. Um, the day prior, I had went for a haircut with me, my wife, and we took our son. We came home. It was like a normal day. Hung out, ate a little bit, and then watched some TV. And I took a nap with the baby. We had a late dinner that day. Um, we took like some home videos of just us spending time with the baby. And then I was actually breastfeeding, which is something having a child was hard for me. Um, so that was always something I wanted to do for sure. Like I wanted to get the whole experience. So I was actually breastfeeding and I had pumped enough just for like the night so my wife could stay with him, and feed him throughout the night. And then I would get up in the morning. And
Okay.
then in the morning, I don't remember much. I know that I got up to go like brush my teeth and I caught like a little headache at first, and then I threw up 3 times, and then the headache was unbearable to the point where I couldn't like get out of the restroom. I had to hold on to the wall. I made it to my nursing chair, and my wife heard me like screaming. So she ran upstairs and she thought at first I just had a bad migraine. So she went down because I used to suffer from migraines. And she went down to get me like the cold compress for my head. And um when she came back up, And this I know from video because we have a camera, and from verbal, I was like slurring my words. I didn't have much of a vocabulary at that point. And she thought I was having seizures because I used to have seizures as a child. So she kind of like put the baby down, tried to tend to me. She's an NYPD officer, so she knows kind of like the basics. So she put me on my side, called 911, and
Mhm.
the ambulance came, and then from there on it was just chaotic. I threw up when the ambulance was here. Um, they brought me, but I from what I know, I had an incident while I was pregnant where I had a similar headache, and like my neck got stiff and everything, and they again she called the ambulance that time, and they took me to, they did nothing. So this time she was begging them not to take me to Rumsey, and they told her that they couldn't like do anything about it. I do remember the paramedics being here, and I remember the girl paramedic saying something like, "Oh, well, you shouldn't have ate those ribs last night," which was really insensitive. I don't understand what that had to do with anything, but yeah. Um, so then we went to, and I remember going in and out of like consciousness,
Mhm.
and I remember my mom, because my wife had called my mom, and my mom made it here from Brooklyn in like 5 minutes. But my mom was there. My wife was still at home because she was cleaning up like the vomit and everything that the paramedics had left. And she was waiting for her mom to take the baby. Um, so I remember my mom saying, like, can somebody help my daughter? Like, she doesn't usually like yell like this. And the girl was like, oh, well, she has to wait to get registered. So my mom waited for like she saw a man in a suit, and she was like, can you do something? Because like they're not doing anything right now. And then at that point, I remember somebody walking over and injecting me with something. And then I don't rem I knocked two. I was in and I heard telling my mom it's a brain bleed. And after that, two again, I'm at NYU, and my cousins actually put in that my cousin was doing the EEG. And so I woke, like when I came to again after, I remember him like working, like putting the things on my head, and I'm like, "You work here?" And he's like, "Jen, you're at NYU." And I was like, "Oh." Like I had no idea, like I was completely lost, lost. Um, but then at NYU, like in the beginning it was weird because my body just felt so like everything just felt like it felt like a dream, like nothing felt real. It was like even when I think back to like the first moment I opened my eyes in the room, I thought I was like in the lobby behind a curtain. Like it was weird, but I know where I was now. But like nothing was making sense in my head. Like
Mhm.
my usual thinking wasn't like happening. Um, but then after that, the treatment, like it didn't process for me that I had like a brain bleed. Like I don't know why it just didn't like register like you went through something so severe. And then when they started talking to me, and when people like I started realizing that my wife was like, oh, like they were telling me like, you know, she's gonna be like this, she's gonna be like this, and it freaked her out.
Mhm.
Then I was like, oh, this is like serious, serious. I got it. Like then I kind of checked in, like, oh, okay, I understand now. Um, but it was definitely a little bit of a struggle. I had I think it's called vasospasm. Dr. Aids, correct me if I'm wrong. And
Got
that's
it.
when, yeah.
Yep, you got it.
Okay. So that was like when my eyes were shifting a lot. And at that point, I think I was throwing up often because of that. And then there was something happening where like the room would flip. And I don't know what that was called, but that was happening for quite some time. Um and then and then yeah, it was slow in the beginning, and then it started to get better little by little.
Oh, that's awesome. So, one thing that I did want to kind of mention for our readers, as well as for yourself, because the ambulance people were telling you the truth. If you call 911, they must take you to the closest hospital. They don't get a choice. They have to go there first. Whether or not you got to be transported somewhere else, they have to take you there. Now, if you were to like when you set out in the beginning, if you wanted to go somewhere else and you know you want to go somewhere else, you can also call one of I think there are three private ambulances on Staten Island where they, for the most part, are covered by insurance for that transport if it's medically necessary. And you can choose where they take you. So you could say, no, I want to go to A, B, or C hospital. If you want to go to NYU Langone straight away, if you think that it's a really serious issue when you were having the issue to start with, that maybe you would want to go off the island or something. That's one of the only ways to do it.
Okay, good to know because I was like, oh, this was, and they took long, so that kind of like was freaking my mom and my wife out that they were just taking so like they were just so nonchalant with it that they were
Yes.
like, don't you think this should be a little bit faster?
So Laura, I wanted to kind of ask you about this condition that she experienced. Like, how common is it? What are some of the warning signs? What should people do if they experience these warning signs? What are severe warning signs, or like so, and also how it's related to postpartum, if it is
Sure.
related to that
Yeah.
at all.
Yep. So, I mean, basically, this was related to an aneurysm. So, aneurysms themselves are slightly more common in women. What it is basically you have a weakness in the wall of your vessel that over time, with some high blood pressure and really just time with blood flow through the vessel, it can bow out and cause a little kind of bleb on the side of a vessel. And because it's got a weak part in the wall, the risk would be any sort of rupture where you would have a bleed. So generally in females, maybe about 1% of us have one of these. Um, it's, just slightly more common in females than males. In terms of the risk of rupture and the risk of what Jennifer had, that really depends on the size of the aneurysm, the location of the aneurysm. So, this around 1% of females that have these, not all of them are going to have a rupture. We find these incidentally when we're doing scans for other reasons sometimes. I will say with pregnancy, there is probably a slight increase in the risk of rupture related to later in the pregnancy and around delivery more than postpartum. Partly because we can get some increases in blood pressure. So, particularly, some of our patients have something called preeclampsia or eclampsia, where you have really severe high blood pressure. So, that can put you at risk for a rupture. Other predisposing things that really don't put you at risk for the formation of an aneurysm, but just can make it worse over time are tobacco use. So those are really the two things. If we find an incidental aneurysm, we just warn people you really can't use any tobacco products, and we have to keep your blood pressure normal. Trying to think anything else I'm missing in what you asked here. I mean, I guess I can at least say the risk of having a subarachnoid hemorrhage. This is where the blood is, the subarachnoid space when you have an aneurysm rupture during pregnancy is very low. So they've done some population studies and it's somewhere around 0.0005%. It's very low. But when it happens, it's very serious. So like Jennifer said, it's something where, this is something where we call a code to get people to the scanners right away because it really needs to be dealt with right away.
Okay. And so this is something that's very uncommon to start with, so or relatively uncommon. So like 1% of people have it, and you wouldn't, it's not like before the rupture happens that there's any
Oh, that's
symptoms.
right. Yeah, I didn't address that. So yeah, a lot of times this doesn't really cause symptoms until a rupture. So when you have a rupture, we typically think of something called a thunderclap headache. So that's kind of similar to what Jennifer described, where you really have a headache that is almost maximal at onset, very severe pain, often associated with stiffness in the neck. People generally are very sensitive to light. That's called photophobia. And then often a lot of nausea and vomiting with the headaches. You sometimes can have a more mild headache if there's a small bleed that repairs itself before a large rupture. So I don't know if that was maybe the case when when you went in before Jennifer. But sometimes you can have something called a sentinel bleed. So sentinel like a warning sign. But generally there's not any other symptom of an aneurysm unless there's a rupture. So
It
that's
was
what we worry about.
definitely painful the first time it happened when I was pregnant. It was like I never felt nothing. They're like, "Oh, I called New York Presbyterian because that was my hospital and I was like, like I have a headache and like there's so many things happening right now like I'm throwing up, it's multiple things." And they were like, "Well, I would let it wait." And I was like, "Wait." So I called somebody I actually was working with because I used to work at the gynecology oncology team. And I was like, "Hey," I was like, "Are you on call?" Because I had some students there, like they used to come in and do work with our surgeons or whatever. And I was like, "Are you on call?" And he was like, "No, what's up?" And I was like, "I need to know who to talk to because I have a headache and I'm pregnant or whatever, like, whatever." And he was like, "Call so and so." So I called back and I asked for this person he told me to ask for. And she was like, "No, you need to come in." And I was like, "Oh, okay." I was like, because I'm getting told to wait and this is not
Mhm.
what I, like whatever. And then I had one, it was just insane.
Okay. And so if somebody was to have like a severe headache while they're pregnant, would that be like something that should prompt like a scan or something like that? Like like whatever. I'm not sure which kind of scan would detect this.
Yeah, yeah. So, I mean, most subarachnoid hemorrhages due to aneurysm, we can see it on a plain CT scan. Um, there are a lot of reasons why people who are pregnant with severe headaches should come in. So, subarachnoid hemorrhage and aneurysm is just one of those things. People who are pregnant are also prone to a form of headache that can happen with clots in the brain. And then there's preeclampsia and eclampsia, where often people have headaches and a handful of other symptoms. So, headache in pregnancy should really be treated seriously.
Okay, that makes sense.
I was also
Um,
preeclamptic
Yeah.
during my pregnancy. I was gestational hypertension and gestational diabetes. And then when I gave birth, when I pushed my son out, I pushed him out in like 8 minutes and I didn't want I had the epidural, but I didn't want anything else. But my blood pressure was high. And I think when I pushed him out, I was at 151 over 110. So I was like on watch for like 24 hours.
okay. So that makes sense. Like that they should have, I guess in that instance, so if somebody has a severe headache, they actually should go to get care.
Yeah, I mean, we do see people who have a tendency to have migraines, and some of the hormonal changes in pregnancy do make you have migraines. So there's always a possibility that you go in and we end up saying, "Oh, we're not seeing anything. This is just a migraine." But, I would always rather have people come in because there's so many other things that we have to worry about with headaches in pregnancy. So, it's never a bad idea to come in. You're not overreacting. It's a good idea to be safe in terms of pregnancy because there are a lot of things that can happen.
Right, right. And one of the things that people in pregnancy are can be subject to is because of the fact that they have all this more fluid in their body because of the way that the body works with pregnancy in relaxing all of the walls of your arteries with extra relaxin and stuff like that during being pregnant. Those kinds of things can increase risk for strokes, increase risk for pulmonary embolisms and things of that nature. So when you have warning signs for those things, it would be better to just go check it out rather
Yeah.
than being like, oh, it's nothing, but you don't know that it's nothing. And it is a different kind of time when a person is pregnant. Like their body is totally different than than it was 6 months before. Completely. A lot of people report that they don't feel like their body is the same.
Yeah, no, absolutely. There are so many things that can happen during pregnancy, not just neurological things, but like you're saying, clots in other places. People can get heart disease and things. So, if something seems out of the normal, even though if this is your first pregnancy, you may not know what's normal or not normal. It's always good to have someone who you can touch base with who can tell you, oh, no, that's not normal. Usually, your OB-GYN is going to be the go-to person for some of these things, and they are pretty good about sending people to the ER when they're worried about one of these complications.
Right, right. And actually they've found in studies that prenatal care in pregnancy improves outcomes kind of like across the board, whether they go to midwives, whether they go to OBs, whether they even go to primary care physicians, they find that they have better outcomes later on because there are things that can get caught earlier. So, I'm not sure if you talked about like warning signs in general for like for like a person who's not pregnant, like what they would be seeing. Like, are there certain, like you said, the thunderclap headache when it actually bursts? Are there symptoms when there's a more minor bleed that doesn't lead to a bursting?
So something where you have a more minor bleed like that sentinel bleed we talked about, sometimes you can have, not quite a severe headache, but generally people are still going to feel pretty bad for a couple days and they might be very lethargic with those types of headaches. Occasionally, if an aneurysm is large enough, it can actually put pressure on surrounding structures. So you can get some headaches from just that pressure, and occasionally you can get some focal symptoms from whatever it's pushing on. So a common one, for example, is we can get an aneurysm in a place where it'll push on the third nerve, which controls movement of the eye and can control your lid. So sometimes we'll see people coming in with some paralysis of one eye and a little bit of a lid drop called ptosis. And we'll look and just make sure an aneurysm's not pushing on it. So occasionally we'll see other warning signs, but that's usually with pretty large aneurysms. Generally, these are more commonly found with the thunderclap headache and people coming in with the larger bleed.
Right, right. And generally, like if somebody was to have like a drooping face and their eyelid and stuff like that, that's a warning sign for something else. And I know that's one of the warning signs for, I think it's strokes, um, in the brain. So like if someone was to have something like that, they should go get checked out either way. Um,
Yeah.
but
There's actually a good mnemonic for stroke signs that we try to use with all our patients called Be Fast. I don't know if you guys have done any pieces on that. But there's a picture of warning signs of stroke. The B is for balance, dizziness, equilibrium. So B for balance, E for eyesight, F for facial droop, A for arm weakness, but also leg weakness. S for speech, slurred speech or trouble speaking. And then the T is just time, because the faster you get in with stroke, the better we can end up having our patients do.
right, right. And for something like aneurysms and that you were talking about before they burst, I think that the aneurysm is when it actually bursts. Is that how it is defined
So
medically?
the aneurysm is just the weak part of the wall with the little outpouching. So the
Okay.
aneurysm is just an abnormality in the wall of the vessel.
So basically, the goal with treatment for when the person comes in and it has burst is to kind of heal the damage, or like what is it that kind of like is the plan like for somebody like
Oh,
that? What
sure.
do they need to do?
Yeah, so I mean, generally, there are several ways to treat it, but our goal is to stop the bleeding. So there are several ways to do that. Sometimes we'll use stents to basically cover up that part of the aneurysm. Occasionally, they'll put coils, or something called a web device, where they're putting something in the aneurysm that's essentially going to stop blood flow to that area and cause it to scar over. So the goal is to just basically scar over that part and then eventually have this normal vessel with good blood flow. So this is all, our neurosurgery teams, neurointerventional radiology teams, and generally these patients are going to the neuro ICU. So I know I'm talking to you today, but we kind of take these patients after they've already had the hard stuff done in the neuro ICU and just try to be that bridge between, when they were very sick with all of the complications and going to rehab and getting better.
Okay, cool. And you can make a full recovery from this kind of thing, of
Yeah.
event.
Yeah, especially, I mean, people at a young age who are going through strokes, through aneurysmal subarachnoid hemorrhage, the brain has an amazing re ability to recover. So our younger patients tend to do very well. It's just a matter of time. It's a slow process. So a lot of our recovery, we're talking about 6 months to a year. But even after that, we're seeing recovery. It's just at a slower rate.
Okay, fantastic. So I appreciate both of you taking the time to meet with us today. Thank you so much. I think this will be very helpful for our readers to learn about these kinds of conditions and the warning signs and things of that nature. So I really appreciate your taking the time to speak with us today.
No problem.
Thanks so
Thank you.
much.
Thank you so much.